Welcome back, listeners. Dr. Sean here. Today I want to go a bit personal and talk about results from a recent blood test I had. This is quite a shift away from neuroscience, which I focus on this channel. I promise I will return as soon as I get this talk out of the way. Just a reminder, I reviewed two topics previously on this channel. Channel name at Dr. Sean-888 for anybody who's not aware. The two topics were the association of sleep patterns and risk of chronic disease and the complexity of brain cells involved in addiction. Check it out on my channel. The links are provided on the screen. Like, share and subscribe if you enjoy it. This talk is a bit more informal. It'll be longer than my previous videos. Please bear with me. You can always watch it in sections or save the video on your channel and return to it and complete it at the time that suits you. Thank you in advance. Let's start. In a way, I feel called to do this, as most, if not all of us, at some point go to the doctor, hospital, or a healthcare provider for some symptom or symptoms or concern, which in most cases lead to ordering of blood work to help the medical team with their investigations and diagnosis. Due to my age, family history, ethnicity, and the fact that I do not go to doctor often, quite infrequently actually, and as my GP recently said, the last blood test we did for you was in 2013, so it's good you came in today for a follow-up. Let's get a more recent set of lab markers on your file by testing a range of things and see what we can make of what comes back. So just the backdrop to all of this was that back in April of this year, 2024, I did an overall health check in my county, Essex County, here in the UK. It's offered for anyone over 40 who is not currently on any medication or in the care of a physician. The program is called the NHS Health Check, which I'm sure some people may be aware of this. It has been specifically designed to identify health risks such as people that are at the chance of developing heart disease, stroke, kidney disease, diabetes, and certain types of dementia, etc., etc. Well, I passed my health check back in April with flying colors, but what puzzled me was that the attending nurse did not measure my blood glucose, and as my other biomarkers were good and I'm not overweight, she felt it was not necessary, nor did she flag it up for follow-up with my GP. So fast forward to August, a few months later, when I had a bit more time on my hands, I circled back and decided I needed to know what my blood sugar levels actually are, because it's quite important. And it is maybe it's quite possible that subconsciously I felt something was amiss. But I wasn't able to connect the dots, let's say, over the last maybe 8 to 12 months. Apologies if my volume is not up to scratch. I've just removed my microphone from beneath my collar, so I'll be keeping it in my hand until I get it sorted. So the presentation is what I'm going to be talking about, and it will outline the results of my recent blood test, as I said before. It also highlights the importance of regular health checks and follow-ups with your doctor or your healthcare team. Please note, based on my request and discussions with my GP, we did not mark every biomarker under each profile, only the ones of particular interest in my case. There's a whole list of other markers. If you are interested, please have a look at Lab Test Online UK website. I've included the link in the reference list. There's a wealth of information on that website. Lab Test Online UK has been designed to help patients better understand the many clinical laboratory tests that are part of the routine care, as well as diagnosis and treatment of a broad range of conditions and diseases. The lab report containing a particular blood test result would normally include reference ranges for each test, so please consult your doctor or laboratory that performed the test to obtain reference ranges if you do not have it indicated on your lab report. And lab test online UK has been prepared under the leadership of the Association of Clinical Biochemistry and Laboratory Medicine, the ACB, with the support from the Royal College of Pathologists and the Institute of Biomedical Science. So these were the following profiles that was done in my blood work: renal profile, a lipid profile, endocrine profile. We tested micronutrient values, specifically vitamin D and B12, a liver and bone profile, cardiovascular health, red blood cell count, and behind my picture is the white blood cell count. So apologies for not being able to see that. Okay, so on terms of the renal profile, here are my results. Okay, the parameters that was measured was eGFR, plasma creatinine, sodium, and potassium. So healthy kidney function and a balance of electrolytes are the important indicators. The eGFR is a filtration rate measure that measures how well your kidneys are at filtering blood. Creatinine is a waste product of your muscles, and it's filtered out by the kidneys from your blood. Sodium, obviously, an essential electrolyte that helps regulate water balance and nerve function. Potassium is another crucial electrolyte that helps with muscle function and heart rhythm, so how your heart beats. And these tests assess kidney function and electrolyte balance. So normal results indicate a healthy kidney function, and a balance of electrolytes. Dysregulation can lead to kidney disease, electrolyte imbalance, and related complications. So as you can see, my parameters were all normal. Normally EFGR, I mean, in this case, it was measured at over 60 milliliters per minute, the flow rate of filtration. In some tests, I've seen it measured as greater than 90. In my case, it's at 60. So I don't specifically know, is it, above 90 or is it just above 60? But that's the way the test was run in this lab, and it says normal. So in terms of my renal profile, everything is A-OK. Okay, so here's my lipid profile. Boom. Okay, LDL, which is also known as bad cholesterol, because high levels of that can lead to plaque formation in your arteries and lead to heart disease. So that's slightly elevated, as indicated. 3.2 should be under 3. Okay, I have normal triglyceride levels, and triglyceride is a type of fat that's found in your bloodstream, which represents excess carbohydrate uptake in your diet. Total cholesterol is fine, slightly high, it should be under 5, but that could be a bit lower. HDL, my HDL is really good. I think that level is quite good for over, so that's quite optimal. Serum non-HDL cholesterol, slightly elevated again. And my triglyceride HDL ratio, if you take that number and your HDL number, divide that 2 and you get that number, it should be under 2. And I think behind that it actually says optimal as well, or normal. Okay, so just remember LDL, bad cholesterol, HDL, good cholesterol. And why HDL is good cholesterol is because it helps remove other forms of cholesterol from your bloodstream. Okay, so these tests measure cholesterol levels, and it also helps assess cardiovascular risk as well as insulin resistance risk. So a high triglyceride HDL ratio is often associated with insulin resistance. So that's not a problem for me because mine is 0.59, under 2. Okay, and this is because high triglyceride levels and low HDL levels are common in individuals with insulin resistance. So normal results will indicate good health. So dysregulation can lead to atherosclerosis, which is the plaque formation in your blood vessels. It can lead to heart disease, strokes, insulin resistance, prediabetes, and diabetes. So a really good lipid profile is quite important to stave off any of those pathologies and diseases. So in my case, while these values were the values in yellow were borderline, it suggests that there may be a slight risk of cardiovascular disease. So we will revisit this again in slide 10 further on in the talk. So just consider these values along with other factors such as age, family history, genetics, smoking status, blood pressure, and obviously HDL levels for a comprehensive review of cardiovascular health. Okay, so here's my endocrine profile. We only measured thyroid function through TSH and free T4, and this is a measure of blood glucose, as free sugar that is in your bloodstream will attach to hemoglobin, which is found in your red blood cells, and because your red blood cells stay in circulation for up to 3 months or 90 days, any free sugars will be floating around on your hemoglobin that is not absorbed by your cells or cleared by insulin, the hormone from your pancreas. And this is how people are diagnosed for prediabetes or diabetes with this level. So let's talk about impaired glucose tolerance. So dysregulation can lead to diabetes, cardiovascular disease, and other metabolic disorders. And clearly, I'm borderline pre-diabetic. Well, that's what it came up with. So a normal range is normally under 42, and this is how we measure it in the UK, millimoles per mole. As a percentage, it's under 6%. Mine was 6.2% and at 44. So the ranges would be anything under 42 millimoles per mole would be normal. You wouldn't have a problem with your blood sugar regulation control. Anything between 42 and I think 47, close to 48, would be classed as impaired glucose tolerance or pre-diabetic, as the Americans would like to name it, but I think we've also started using that nomenclature of pre-diabetes. And anything over 48 millimoles per mole would indicate a diabetes diagnosis. All right, so clearly that is something that needs to be looked at. Okay, thyroid levels. My TSH and the free T4 was normal. So basically my thyroid is working fine. Dysregulation obviously in your thyroid gland and your hormones in your gland would be a concern, just in terms of it can lead to hypothyroidism, so like a low thyroid function. Some people say it's slow metabolism. It can lead to a hyperthyroidism where it's overactive. So hypo would be underactive, hypo would be underactive, hyper would be overactive, and that can lead to certain types of metabolic conditions and issues. Okay, so in terms of micronutrient levels, we only measured vitamin D and vitamin B12 because I mentioned to my GP when I went for a request for my blood test to be done that I felt I suffered from some fatigue, and you know, he said, okay, let's look at those levels. In addition, you could possibly look at, when you talk about fatigue, and lethargy and stuff like that, you could possibly ask for iron, your iron levels to be measured as well, because if you're low in iron levels, that could lead to anemia, and some of the symptoms and signs would include some of this. But in my case, it was only vitamin D and vitamin B12 levels that was measured, and here are my results. Okay, so I live in England, in the UK, and anything over 50 nanomoles per liter is adequate. I don't know what the top range would be, but I'm on 59, so I'm fine. I wouldn't say it's optimal, but I am fine. Not a lot of sun in the country, so we need to be able to get vitamin D's from other sources other than the sun. So probably nutrition and diet, or you can take supplementation. Vitamin B12, my levels are normal, so that the symptoms I was mentioning in terms of the fatigue doesn't play out in my micronutrients here. So there must have been another cause, and I obviously will get to that a bit later. Okay, so that's all good. So let's just think, why is vitamin D important? Okay, vitamin D is crucial for calcium absorption in your gut, which is essential for maintaining healthy bones and teeth. It helps prevent rickets in children and osteomalacia in adults. All right, if you don't know what it is, osteomalacia, look it up. Vitamin D is also important in immune function. So it plays a role in modulating the immune system and helping to protect against infections and diseases. Okay. Funny enough, it's also involved in mood regulation, and not a lot of people know this. So adequate levels of vitamin D has been linked with mood regulation and may prevent depression. Okay. Another key function is chronic disease prevention. So sufficient vitamin D levels are associated with a lower risk of chronic diseases such as cardiovascular disease, diabetes, and certain cancers. Okay, so what about vitamin B12? So vitamin B12 is really important for red blood cell formation. So the production of red blood cells. So if there's a deficiency in vitamin B12, depending on what else is going on, a deficiency can lead to megaloblastic anemia, which causes fatigue and weakness. All right, so I'm in the clear on that one. Vitamin B12 is also important in neurological functions, so it is crucial for maintaining the health of your nerve cells and support of your cognitive function. Sorry for that. DNA synthesis. B12 is necessary for DNA synthesis and cell division and energy production, so it helps convert food into energy, and it plays a key role in metabolism. So if you are deficient in vitamin B12, there will be a lot of signs and symptoms present, because it's quite key. So dysregulation, like I said, of these two micronutrients can lead to immune system issues, bone health issues, anemia, metabolic and neurological problems. Okay, so liver and bone profile. Here are my results. We've only tested albumin, alkaline phosphatase, and adjusted calcium. There's a lot more that you can test for in terms of your liver and bone profile, but we test based on what symptoms and signs you present with, and I did not indicate anything in my previous medical history at my GP did not show that there was anything else that we needed to test for, so it was kind of assumed that that was fine. But I'm pretty sure that if I had flagged up anything, in addition, more markers would have been tested. So what is albumin? So albumin is a protein that's made in the liver, and it helps keep fluid in your bloodstream so it doesn't leak into other tissues. It's quite an important protein. It also carries various substances through your body, including hormones, vitamins, and enzymes. So albumin is important for liver function, And albumin levels can indicate how well your liver is functioning. It's important for nutritional status. So low levels of albumin suggest malnutrition or some protein deficiency. It's also important for kidney function. It helps assess kidney function, as low levels can indicate that the kidneys are not retaining albumin properly. So if albumin is leaking through your urine, through your kidneys, and the albumin is a big protein, that is a problem. It should not be doing that. Okay, so in terms of alkaline phosphatase, ALP, that's an enzyme found in several tissues throughout your body, with the highest concentrations found in the liver, your bile ducts. That's linked with your liver to your gallbladder and links to your small intestine, your stomach, and your bones. So the importance of ALP is liver health. So elevated levels can indicate liver disease or bile duct obstruction. And here we can think of stuff like gallstones that can either get stuck in your gallbladder or in the duct itself. And that's very painful, and it needs, in most cases, needs to be removed surgically. And in some cases, if it's really bad, you may have your gallbladder removed. Okay, so it's important for liver health. ALP is also important for bone health. So high levels can also suggest bone disorders such as Paget's disease or bone metastases. Bone metastases would be like a bone cancer, a cancer that has spread to the bones, put it that way. Okay. It's also important for growth. So in children and adolescents, high levels are normal due to the need for the bones to grow into adulthood. Okay, so the last parameter is calcium. We all know what calcium is all about. It's vital for many bodily functions, including bone formation, muscle contraction, and blood clotting. So in terms of bone health, calcium levels help assess bone health and detect conditions like osteoporosis. It's important for parathyroid function. It can indicate parathyroid gland function, as these glands help regulate calcium levels. And kidney function. Abnormal levels can suggest kidney disease, as the kidneys help regulate calcium balance. So liver function, bone health, and parathyroid functions are within normal limits, as indicated. And healthy liver, adequate nutritional status, and proper kidney function. So dysregulation can lead to bone disease and or liver disease, such as jaundice, yellowing of the skin and the sclera of the eye, and other hepatic liver conditions. Okay, so cardiovascular health. What are we looking at? Okay, so the parameter is a Q-RISK-2 score. My result was 2.31, which indicates low risk of suffering a cardiovascular event within the next 10 years. So anything under 10% is low risk. Anything over 10% to, I think, 20% is, I would say, risk. Medium risk, and high risk is over 20% over the next 10 years. My blood pressure, 118/72. This is an average of a few readings. Obviously, 120/80 is normally the cutoff for normal, and this is for individuals who are not on high blood pressure medication or have issues with high blood pressure. So what is the Q-RISK-2? It's a predictive algorithm that's used by healthcare professionals in the UK to estimate the risk of developing cardiovascular disease over the next 10 years. It takes into account various factors, including your age, sex, ethnicity, cholesterol levels, blood pressure, smoking status, and your medical history. The importance of Q-RISK, it's used for risk assessment, so it helps identify individuals at high risk of cardiovascular disease. and it allows for early detection and intervention. It helps influences decisions on lifestyle changes that's needed and potential medication to lower the risk for those that are identified. So a low cardiovascular disease risk due to acceptable lipid profile. So if your lipid profile is good, if your blood pressure is within a normal range, if you're not a smoker or you don't drink a lot of alcohol, I think, yeah, your levels would be, your risk level would be low. So the higher the score, the greater the risk, as I said before. Also, the more risk factors you have, the greater your risk. Okay, so let's just recap. So anything under 10% is low risk. Moderate risk is a number that comes back between 10 and 20%, and high risk is a number that comes back over 20%. So I think my cardiovascular health is good. All right, C-reactive protein, just called CRP. So CRP is a protein produced by the liver in response to inflammation. It's a general marker used to detect inflammation in the body. So elevated CRP levels can indicate infections, chronic inflammatory diseases, or other conditions such as cardiovascular disease. CRP levels are often used to monitor the severity of inflammation and effectiveness of treatments for inflammatory conditions. Okay, so my levels are good. So no significant inflammation or infection was found at the time of testing for my blood work. And dysregulation can indicate, so if your levels are higher than 5 milligrams per liter, it can indicate infections. You may have a chronic inflammatory disease, which means that marker will be elevated. And also, if it's a high number and it's not any of the others, there's cardiovascular risk. So it's quite a good general marker to look at for overall inflammatory responses within the body. Okay, so red blood cell count is part of my blood work. There's quite a few parameters, and all of that was measured. Okay, so hemoglobin. A few slides back I talked about hemoglobin with respect to excess glucose, excess sugar molecules in the blood that attaches to your hemoglobin, which is found in your red blood cells, and that stays in circulation for the duration of how long red blood cells actually, circulate. It's up to 90 days. So what is hemoglobin? Hemoglobin is a protein in the red blood cells that carries oxygen from the lungs to the rest of the body. So it's crucial for providing energy needed for cellular functions. Okay. If we just go down the list, red blood cell count, this is just a measure of the number of red blood cells in a given volume of blood. So RBCs, as we call it, are essential for transporting oxygen and removing carbon dioxide from the body. Okay. Hematocrit. Hematocrit measures the proportion of blood volume occupied by red blood cells. It helps to assess the blood's ability to carry oxygen. Okay. I'm just going to whisk through some of these. The mean cell volume, MCV, indicates the average size of red blood cells. So it helps classify types of anemia. So if people are microcytic, normocytic, or macrocytic, this is the parameter that hematologists, doctors, and the like will look at. Okay, mean cell hemoglobin. Okay, that's just a measure for the average amount of hemoglobin per red blood cell. So this helps diagnose different types of anemia. And then mean cell hemoglobin concentration is just a measure of the concentration of hemoglobin in a given blood volume of red blood cells. So it helps identify conditions like spherocytosis or hypochromic anemia. So hematologists would love doing this type of thing because that's essentially what they specialize in. Red cell distribution with RDW. is a measure of the variation of the size of your red blood cells. So higher values outside of the normal range can indicate a greater variation in size, which can be seen in certain types of anemia. So there's different types of anemia that can occur. So that helps with the classification. And then lastly, platelet count. Apologies. So platelets are essential for blood clotting. So if you ever cut yourself or there's a wound, if the bleeding stops after a while, that's when clotting factors are active, and it's involved with stopping the bleeding and also healing the wound. So a normal platelet count indicates a healthy ability of your body and your cells to form clots to stop the bleeding, which is quite important. Okay, and my count is within range. So on my red blood cell count parameters, I'm actually all good. Okay, so there's healthy red blood cells with no abnormalities detected. Normal results indicate good overall health. Dysregulation can lead to anemia, infections, and certain types of blood disorders like hemophilia, sickle cell disease, thalassemia. There's quite a range of blood disorders that can occur and will affect the red blood cells. Okay, that's it for the RBCs. Okay, now we're looking at the white blood cell counts, WBCs. There's quite a few parameters on these as well. And there you go. So total white blood cell count measures the number of white blood cells in a given volume of blood. Okay, white blood cells are crucial for fighting infections and play a key role in the functioning of the immune system, as many of you will know. So if there's different types of white blood cells. Okay, so neutrophils is the first one below the total white blood cell count. Neutrophils are the most abundant type of white blood cells and are the first responders to bacterial infections. Lymphocytes is the next one. They are vital for the immune response, including the production of antibodies and the destruction of infected cells. So antibody productions, lymphocytes. Monocytes are involved in the removal of pathogens and dead cells from the body. They also play a role in people that suffer from chronic inflammation. Eosinophils, they're involved in the response to parasitic infections and allergic reactions. And then basophils are the least common type of white blood cells and are involved in allergic responses as well, and the release of histamine. So when you have those symptoms of watery eyes, swollen eyes, sneezing, and then the association with nasal drip, almost like a cold type, cold type symptoms, but watery red eyes, itchiness, that is because your body is releasing histamine, and that's the work that comes from the basophils who does that. So if you're taking an antihistamine, it's meant to block histamine production or excessive histamine release, which gives you then the signs and symptoms of a pollen reaction or any reaction from your system that is triggered by an allergen. Okay, so my white blood cell count is all normal. So healthy white blood cell count, no abnormalities, illness or inflammation detected, and it means overall good white blood cell health, which I'm happy about. And I wasn't actually sick at the time when I had my blood taken, so I wasn't expecting anything to come up on this slide. But in terms of pathology, okay, let's just think. Abnormal and dysregulation of white blood cells can have serious effects on health. It goes without saying. Okay. There's one particular key one to look out for. Leukopenia, which is a low white blood cell count. And that's the second one over there. All right, let me just find my spot. Sorry. I've got some notes on this because I can't remember all these things off the top of my head. So leukopenia low white blood cell count is increased infection risk. So a low white blood cell count can weaken the immune system, making the body more susceptible to infections. Even minor infections can become severe. The effect can also lead to, leukopenia can also lead to delayed healing. So reduced white blood cells can impair the body's ability to heal wounds and recover from illness. So conditions like bone marrow disorders, autoimmune diseases, severe infections, and certain medications, such as medications for chemotherapy, can cause leukopenia. Another one to note is leukocytosis, which is basically the opposite. It's a high white blood cell count, and that's found in chronic inflammation. So persistently high white blood cell counts can indicate chronic inflammation, which is linked to conditions like rheumatoid arthritis, inflammatory bowel disease, and chronic infections. If we think about blood clots, so elevated white blood cell levels can increase the risk of blood clots, leading to complications such as deep vein thrombosis or pulmonary, which is lung, embolism. And the causes: infections, inflammation, stress, certain cancers like leukemia, so blood cancer, can cause leukocytosis. So specific white blood cell dysregulation, neutropenia, that is neutrophils. If it's low, neutropenia, that can lead to severe bacterial infections and sepsis. Lymphocytopenia, a low lymphocyte count can impair the body's ability to fight viral infections and may be seen in conditions like HIV and AIDS. Eosinophilia is a high eosinophil count. It can indicate allergic reactions, parasitic infections, or certain cancers. And then monocytosis is a high monocyte count, can be a sign of chronic inflammation, inflammatory conditions of certain types of leukemia. And basophilia, well, a high basophil count can be associated with allergic reactions, chronic myelogenous leukemia, CML, and other blood disorders. So blood disorders and cancers. Well, there's leukemia, which is a type of cancer characterized by the uncontrolled production of abnormal white blood cells. It can lead to symptoms like fatigue, frequent infections, easy bruising, and bleeding. Lymphoma, it's another cancer of the white blood cells, but it's linked to the lymphatic system, which includes lymph nodes and lymphocytes. It can cause swollen lymph nodes, fever, night sweats, and weight loss. And then we have MDS, which is myeloblastic syndrome, a group of disorders caused by poorly formed or dysfunctional blood cells leading to anemia, infections, and bleeding disorders. And then we have autoimmune diseases, autoimmune neutropenia. The immune system mistakenly attacks neutrophils, leading to increased infection risk. We have autoimmune lymphoproliferative syndrome, ALPS. It's a mouthful. A condition where the immune system produces too many lymphocytes, leading to enlarged lymph nodes, spleen, and liver, and increased risk of autoimmune diseases. Now, that was quite a mouthful. And if you're interested in any of these, you can just re-watch parts of the slide presentation, especially this one, make a few notes, and you can actually just Google it up or ask, anybody like a doctor or healthcare provider to give you more information if you are concerned. But as you can see, my parameters are all good, and I wasn't expecting anything to come up on this before I had my blood taken. Okay, so my blood test summary. I'm going to keep my camera off because a lot of what is following will take up a lot of the slide, and I don't want my profile image to obscure some of the the bullet points on the following slides. So key points, let's just quickly summarize. My cardiovascular health, I've got a low QR risk 2 score. I've got a normal blood pressure and mostly normal lipid profile. Remember, I only had 2 slight elevations in my LDL and my non-serum HDL, but that was ever just over the normal range, which I'm not concerned about. And the main reason also is because my HDL is quite good, and HDL is the good cholesterol, and it's quite a protective factor. So if that number is high, I'm less likely worried about my LDL being slightly over. Okay, this one in red, that's the big one. Elevated glycated hemoglobin levels, HbA1c as it's called. Yeah, it highlights the need for lifestyle changes, i.e. diet, nutrition, and activity levels. And this is needed to bring my blood glucose within range. Now, my doctor did not say that I needed to have my blood glucose tested every 3 months. In actual fact, I was notified that they will do an annual review of my blood glucose, of my HbA1c. So we'll have to test it once a year, but in the meantime, make some of these lifestyle changes and we can revisit it. But I'm more inclined to have my levels tested again 3 months after this blood test. Because at that time, I will have a new set of red blood cells circulating in my system, and I will see how much sugar that's left in my blood will attach to the hemoglobin that will be picked up by the test. So it's almost like if I do the right things and I clear my system properly, then I should see those levels go down from the pre-diabetic and intolerance to glucose metabolism into the normal range. Okay. My kidney function, liver function, it's normal profiles. Thyroid function, normal. My vitamin D and B12 levels, adequate and normal. No infections, no inflammation. Therapy was normal. And my blood health, so my red blood cells, white blood cells, they were all pretty normal. So I'm really happy about that. So there's only the blood sugar levels that, yeah, that's a bit of a problem. Okay, so I'm going to talk a little bit about blood sugar. This is just a quick overview. I'm not going to go into too much detail. There's a lot of resources available on the internet, on YouTube, and other social media platforms from people who are much more clued up about, blood sugar and insulin than I am. So feel free to actually do your own research. But because of my issue that was brought up, I'm just going to quickly talk a little bit about it. Okay, so what do we have here? Normal blood glucose levels. All right. So if your glucose levels increase in your blood, it reaches hypoglycemia. That's the state it's called. Then your pancreas, the beta cells in your pancreas releases the hormone insulin. And insulin acts on your liver and your cells to stimulate them to take up the excess glucose from your blood and turn it into glycogen in the liver, and your cells can use it for energy. Okay? If this works correctly, your plasma glucose levels will return to normal a few hours after you had a meal or you had a carbohydrate intake or a spike in your blood glucose. That's when it works. On the other end, the opposite side, if you go into low blood sugar, hypoglycemia, your pancreas will your pancreatic alpha cells will release glucagon. And glucagon is another hormone that will act on your liver and take the stored glucose that's in the form of glycogen, convert it into glucose through this process, gluconeogenesis and glycogenolysis in the liver, and it will release glucose into your plasma to normalize your blood glucose levels. That's how it should work. Now, I think in my case, if I can just get this pointer to work, that's the normal, that's your blood vessels. So when you have a blood sugar problem on the elevated side, hypoglycemia, there's your beta cells. That tries and clears it. I think my problem, or that of many people who may have prediabetes or a problem with insulin resistance or diabetes, is the pancreatic B cells that releases insulin. It doesn't act on the cells, or it acts on the cells, but the cells are not actually taking glucose from the bloodstream. So your insulin would act like a key to try and unlock the cells to allow glucose to be taken up, but something has gone wrong there. Same in this case. To turn glucose into glycogen is a bit of a problem in the liver, and insulin is not, the liver is not responding to insulin, or there is something else that's gone awry in this part of the process. And I think that's where my problem lies. And then obviously your plasma glucose levels will not return to normal and will stay elevated. And that is what is picked up on the HbA1c test. Okay. I hope that makes sense. If not, there's a lot of information on the internet and on YouTube that explains this in a lot more detail than what I can ever do. But I hope that just makes a bit sense now. Okay. Okay, so insulin resistance. What is it? And how does it relate to diabetes? So I just pulled this off the internet from Abbott. And insulin resistance occurs when the cells in your muscles, your muscle cells, your fat cells, and your liver cells don't respond well to insulin. And as a result, the body needs to produce more insulin to help glucose to enter your cells. Now, insulin is like a key that unlocks cells to let glucose in, where it's used for energy. When cells resist the key, the glucose builds up in the bloodstream instead of being used. So the body's response is to compensate. The pancreas will make more insulin, but over time, and we can talk years and decades, the pancreas can't keep up of just producing insulin, and the body cells don't respond. The fat cells, the liver, and the muscle cells don't respond. So it leads to excessively high elevated levels of blood sugar. And that is what insulin resistance means. It's nicely explained by Dr. Berg, who some of you may have heard about, seen on social media. He's quite active, very knowledgeable. He's got a video called Understanding Insulin Resistance on YouTube. If you put it in the search function in YouTube, call it up, he explains it quite nicely on there. I just need to touch on insulin resistance. Okay, so what are the signs and symptoms of insulin resistance? Key signs. Initially, there are no symptoms. I mean, insulin resistance can develop silently without noticeable symptoms early on. But over time, you get the following. So I've indicated in red what you can see. Acanthosis nigricans, if I'm saying that correctly, is darkened patches of skin, usually in the folds of the neck, armpits, or groin. So there we go. You start seeing that on your skin. Another one would be increased hunger. Since the cells aren't getting the glucose they need, you may feel hungry even after eating, and that's why a lot of people end up snacking and have cravings. Another key symptom is fatigue. So I'm just going to load all that up, if you can read that. With glucose not efficiently entering cells, energy levels may drop, causing fatigue. Inevitably, we're talking about weight gain, especially around the abdomen. And specifically, we're talking about visceral fat. So that image there. So basically, the fat under the skin is subcutaneous fat, which is what we normally see, the belly fat. But there's also the visceral fat, and that's the fat between the organs. And I would like to call that invisible fat. And that's where a lot of the glucose will sit, in the fat cells in the abdomen region, the belly region. Okay, another symptom would be high blood pressure and abnormal cholesterol levels. And insulin resistance is linked to metabolic syndrome. Metabolic syndrome is not a single condition, but a collection of health problems that happen together, raising the risk of serious health issues like heart disease, diabetes, and stroke. Okay, so if you start seeing skin tags, darkening of the skin, and these patches, and also I think in excessive hair growth, like sometimes in females, and that's got to do with probably like some sort of like a growth hormone. These are some of the symptoms that, just to note, not everybody has all the signs and symptoms of insulin resistance. Some people will have all of them, some will have one or two. So if you have quite a few of these and you have some of these other symptoms I mentioned, it may be time to get your glycated hemoglobin tested if you don't know what your levels are. Okay, so what are the key components of metabolic syndrome? Like I mentioned, it's high blood pressure. So we're having consistently elevated blood pressure, high blood sugar, so insulin resistance that causes blood glucose levels to rise, abnormal cholesterol levels, so low levels of good HDL cholesterol, but high levels of bad LDL cholesterol and triglycerides. Also excessive fat around the abdomen, as I said before, a larger waistline, particular fat stored around the belly. So just to recap, key metabolic syndrome, high blood pressure, high blood sugar, abnormal cholesterol levels, and excessive fat around the abdomen. So insulin resistance is a core problem in a metabolic syndrome. It leads to high blood sugar, fat accumulation, especially around the abdomen, which causes other components like high blood pressure, abnormal cholesterol. However, it can often be managed with lifestyle changes, including better diet, regular exercise and movement, and weight loss. Okay, so I'm just going to put the diagram, like a graph up here. There we go. So now we're talking about insulin resistance, prediabetes, and diabetes. What's the difference? And what's the link between the three? So prediabetes, when the body's insulin production can't keep up with insulin resistance, blood glucose levels rise but are not high enough for a diabetes diagnosis. HbA1c levels for prediabetics are in the range of 42 to 47 millimoles per mole, and that is about, another measure would be 6 to 6.4% as a percentage. Okay. And then type 2 diabetes. So if insulin resistance continues unchecked, the pancreas can no longer produce enough insulin, leading to persistently high blood sugar levels. And then it leads to a diabetes diagnosis where your HbA1c will be over 48 millimoles per mole or over 6.5%. And if you just look at the graph, this is a normal function. Let me just put on the pointer. Insulin resistance, that's normal. Insulin production, normal. Blood sugar, normal. In this state, you'll start to see your blood sugar rising. So that's pre-diabetic and IR, and this is into diabetes. You'll see your insulin production initially go up to cope with the increase in the blood glucose, but at some point insulin resistance happens, and then your pancreas can't keep up, and then your insulin levels will drop, but your blood sugar will stay high. And when that happens, insulin resistance go up, and then in type 2 diabetes, it won't come down. You'll just be insulin resistant until you make changes or go on to some medication to help control your blood sugar. So why does it matter? Insulin resistance is a major driver for both prediabetes and type 2 diabetes. So recognizing and managing insulin resistance early through lifestyle changes can prevent or delay diabetes. And I've seen on social media a lot of people say you can actually reverse diabetes, or you can reverse prediabetes or insulin resistance. I think you can reverse insulin resistance and prediabetes. It just depends how far along you are and what other conditions and chronic conditions you are struggling with, if you're able to actually reverse diabetes, or maybe you can just control it better through lifestyle changes and not suffer the normal complications that people get with diabetes over a lifespan. So blood sugar and genetics, it had me thinking. I'm not overweight, never was. Everything was fine. All my other biomarkers are fine. Why am I pre-diabetic? And it's quite puzzling. And I did some research and looked around a little bit to try and find the answers. And there's a genetic predisposition to elevated blood sugar and insulin resistance. So inherited traits and genetic factors are passed down from parents. They can influence how your body manages blood sugar levels. So it's genetic. There's also gene variation. So specific variations in genes can affect insulin production and how cells respond to insulin. The third one under genetic predisposition is the beta cell function that's in your pancreas. The efficiency of the beta cells in the pancreas, which produce insulin, can be impacted by genetic factors. And your insulin receptors. So there's genetic differences that can affect the number and functionality of insulin receptors on cells, influencing insulin sensitivity. So why genetic pathway matters? There's a metabolic pathway. So understanding genetic influences on metabolic pathways helps us identify how the body processes glucose and responds to insulin. And what do? Well, you can go for testing, genetic testing. So testing can identify specific genetic risks for insulin resistance and diabetes, allowing for a personalized management and treatment plans if you do genetic testing. So you can identify it and say, okay, what do I need to do to get better or to reverse? The more common one would be lifestyle modification. So adopting a healthy lifestyle, including a balanced diet, regular movement and exercise, can help manage and mitigate the genetic risks. You will still be predisposed to it, but you're now managing it. And obviously, how do you keep track of it? Regular monitoring, so keeping track of blood sugar levels and other health indicators can help in early detection and management of potential issues. So unfortunately for me, or shall I say fortunately for me, I have a problem because of a genetic predisposition that runs in my father's side of the family. And now that I'm aware of it, I can do something about it, but I need to understand it may not have been totally lifestyle, my lifestyle I was living and my activity levels. It just means that if the right conditions present, you are predisposed genetically to actually get, insulin resistance, prediabetes, diabetes. Okay, so let's get to the next slide. So let's talk about ethnicity and insulin resistance. So what is the ethnic differences and how does it affect insulin sensitivity? Okay. African and East Asian populations. So research indicates that individuals from African and East Asian backgrounds often have higher levels of insulin resistance compared to other ethnic groups. This can be due to genetic factors that affect how their bodies respond to insulin. Caucasian populations, generally Caucasian populations, white populations, tend to have lower levels of insulin resistance. However, lifestyle and environmental factors can still significantly impact their insulin sensitivity. So if you're African, East Asian, Caribbean, any non-white populations, you're at a higher risk of, shall I say, insulin resistance. And your insulin sensitivity will be lower. Doesn't mean that white populations can't get, they do, but the incidence is higher in the non-Caucasian populations. We're back at genetic factors. Certain gene variants are more prevalent in specific ethnic groups, influencing their risk of developing insulin resistance. For example, some genetic markers associated with insulin resistance are more common in African and East Asian populations. Okay, talk about beta cell function in the pancreas. The efficiency of beta cells, which produce insulin, as you know, can vary amongst different ethnic groups. So genetic differences can affect how well these cells function, impacting overall insulin sensitivity. Then we can look at environmental and lifestyle factors. So diet and physical activity. Dietary habits and levels of physical activity can vary widely among different ethnic groups, including insulin sensitivity. So for instance, traditional diets high in refined carbohydrates and sugars can increase the risk of insulin resistance. I think that we know. What about socioeconomic status? Socioeconomic factors can affect access to health, to healthy foods, healthcare, opportunities, physical activity, and all contributing to disparities in insulin resistance amongst different ethnic groups. So I think, and this is a generalization, the poorer you are, the more you will be affected by insulin resistance or getting it. So your diet will be poorer, your access to healthcare will be affected. So all these things we don't normally think about, but it definitely plays into it. You know, how society is organized and how people live in different parts of a particular community or in society. There's also something to think about in terms of health disparities. So differences in access to healthcare can lead to differences in diagnosis, treatment, and management of insulin resistance and diabetes. So ethnic minorities often face barriers to accessing quality healthcare, contributing to higher rates of complications and to poorer outcomes. So when I say ethnic minorities, we mean non-white populations, but also within white populations from lower socioeconomic groups, these factors will obviously affect them as well. Why this matters? Understanding the interplay between genetic, environmental, and lifestyle factors is crucial for developing targeted interventions to manage and prevent insulin resistance and diabetes in diverse populations. Personalized approaches that consider these factors can help improve health outcomes across different ethnic groups. The following slide seems will seem a bit strange, but it actually ties in with insulin resistance or poor sleep on insulin resistance and diabetes. So let me just populate that. Insulin sensitivity. So the impact of poor sleep on insulin resistance and diabetes. So poor sleep can decrease insulin sensitivity, meaning the body's cells become less responsive to insulin. And this can lead to higher blood sugar levels and increase the risk of developing type 2 diabetes. Blood sugar levels. Lack of sleep can cause fluctuations in blood sugar levels. So both high blood sugar, hypoglycemia, and low blood sugar, hypoglycemia, can disrupt sleep, creating a vicious cycle. Next one, appetite regulation. So sleep deprivation affects hormones that regulate appetite, such as ghrelin and leptin. So increased ghrelin levels can lead to overeating and weight gain, which are risk factors for insulin resistance and diabetes. Inflammation. So poor sleep can increase inflammation in the body, and chronic inflammation is linked to insulin resistance and can contribute to the development of diabetes. And this next one is not a surprise for me. Just pop that one in. Chronic stress. So the lack of sleep elevates stress hormones like cortisol, which can interfere with insulin production and increase blood sugar levels. So that's an important one. Cultural factors. So cultural attitudes towards sleep and lifestyle can influence sleep patterns and consequently the risk of insulin resistance and diabetes. For example, cultures that prioritize long working hours, or maybe they're forced to work because of socioeconomic conditions. So long working hours, they may experience higher rates of sleep deprivation, and that feeds back into poor sleep, hygiene, and then into insulin resistance. And I think the next one, family and social structures. Sounds a bit of an odd one, but hear me out. So family habits and social support systems play a role in sleep quality. So supportive environments can promote better sleep hygiene, reducing the risk of insulin resistance and diabetes. So why does this matter? So understanding the connection between sleep and metabolic health is crucial in preventing and managing diabetes. Addressing sleep issues can improve insulin sensitivity, stabilize blood sugar levels, and reduce the risk of developing diabetes. And another point, just to stress, if you get enough sleep, and I did a video on sleep patterns and chronic disease previously on my channel. If you sleep, your body goes into clean up and restore mode, and it basically helps clean the system out. So if you have good sleep hygiene, it helps with regulating your blood sugar levels when you're sleeping. And if you get enough sleep, it's a positive effect. When you have too little sleep, or you're an insomniac, or disrupted sleep, then it just leads to a greater chance of slow walking into insulin resistance and diabetes eventually. Okay, that's that slide. Okay, so importance of good sleep hygiene goes without saying. Okay, so what are the tips for good sleep hygiene? So maintain a constant sleep schedule. And I think I did mention it on my previous video on sleep patterns and chronic disease. If you go to that one, there's a couple of links that I've shared there as well that can give you some tips on good sleep hygiene. Go to bed and wake up at the same time every day, even on weekends. So be consistent. Create a relaxing bedtime routine. So engage in calming activities before bed, such as reading or taking a warm bath. Some people can meditate. Some people can do, breathing exercises, mindfulness exercises, anything that calms your system down. Optimize your sleep environment. So let me just pop down. Consistent sleep schedule. Yep. Sleep environment. Okay. Optimize your sleep environment. Ensure your bedroom is cool, quiet, and dark. Consider using earplugs or an eye mask if needed. If you're too hot and the bedroom's too hot, you're going to struggle to fall asleep and stay asleep. Okay. What else can you do? A big one. Limit any stimulants. Okay. Limit exposure to screens. Avoid screens, phones, tablets, TVs, at least an hour before bedtime. So the light from these devices can interfere with sleep and also with your body getting into that sleep prep mode. It keeps you more alert, and then we wonder why we struggle to fall asleep. Okay, so relaxation techniques. Okay, be mindful of food and drink. So avoid large meals, avoid caffeine and alcohol close to bedtime. I would say probably about maybe an hour, 2 hours before bedtime. But I mean, the earlier you can eat, the better, depending on your schedule. Okay, I think I skipped one of my points on that previous slide, but I'll just move on to this one. So the role of stress in insulin resistance and diabetes. I mentioned it before. Chronic stress. Chronic stress can lead to prolonged elevation of stress hormones like cortisol and adrenaline. These hormones can interfere with insulin's ability to regulate blood sugar, leading to insulin resistance. Okay, socioeconomic stress. So we were talking about socioeconomic factors a few slides ago. Now we're talking about socioeconomic stress. Financial instability, job insecurity, and living in high stress environments can contribute to chronic stress. These socioeconomic stresses can be linked to higher rates of insulin resistance and diabetes. And this may be a contentious one. Discrimination and racism. So some research have shown that experiencing discrimination and racism and prejudice can cause significant psychological stress on an individual, which can negatively impact them metabolic health. This stress can lead to increased insulin resistance and a higher risk of diabetes. So why this matters? So understanding the interplay between stress, genetics, cultural practices, and healthcare access is crucial to understanding insulin resistance and diabetes in diverse populations. By recognizing these factors, we can develop hopefully targeted interventions to reduce disparities and improve health outcomes for all. Okay, so in conclusion, and what are the next steps? What this talk has shown is that it's quite important to have regular health checks and to be proactive about your health management and to do follow-ups with your healthcare provider, GP, doctor's office. It's important to understand the role of ethnicity, genetics, epigenetics in insulin resistance and diabetes, and that can provide valuable context for your health. Understand other risk factors that play into insulin resistance and diabetes. And finally, Speak to your doctor, your healthcare provider, your healthcare team if you are at all concerned about anything discussed in this talk. Finally, here are the references and useful links. There's a research paper by Hades Dahl et al. On the role of glucagon in the pathophysiology and treatment of type 2 diabetes, published in the Mayo Clinic Proceedings in 2018. There's a DOI. You can actually Google that yourself and find that paper. It's open access. You'd be able to access all the information in there. And all the images that was used in the presentation, I've listed them all here with relevant links of where to find them, and there's additional information on insulin resistance, prediabetes, and diabetes in all the links. And finally, I've shared the Association of Laboratory Medicine's lab test online UK's website, where there's a list of all known conditions, all types of tests that can be ordered through your blood work, what the tests are for, what the reference ranges would be, is included in that final lab test link. So, in conclusion, as always, if you found this talk informative, interesting, please support my channel with a like, a share, and a subscribe. And of course, please leave comments below if there's any questions you have. I may not have been clear, or I may have rushed through some of the results or just touched on it at the surface level. If you need to know more or want to comment on your own experiences, have particular questions regarding what I've shared, please leave a comment and I'll respond as best as I can, or I will signpost you to resources that will give you the answers or would be helpful for you. For those who made it to the end of this talk, and I know it's been 1 hour and 17 minutes in the going, so thank you so much for bearing with me, and I really appreciate it, and I thank you for your time. It's quite possible that I will do a follow-up talk on this one, as I plan to have my glycated hemoglobin levels tested again in a couple of months' time, see what the results would be, and then compare September's results to the next test result, and take learnings from that. In the meantime, I will return to my usual research short topics on brain science and neuroscience in the near future. I'd like to thank you for your time. Bye for now.